Hi everybody, my name is Dr. Sehbaj Kaur and I just cleared my NEET PG 23 examination and secured an All India rank of 1304. This was my second attempt in NEET PG. Last year I secured a rank of 44,000 and I had this huge jump from 44,000 to 1304. I'll be telling you my story, of course. I'll be pursuing my post-graduation in MD dermatology soon. I am making this video for those students who are preparing for NEET PG 24 and I'm going to be telling you 3 things which are non-negotiable to be able to crack your exam and to be able to get a rank under 1000 or maybe even under 500. So let's move on to our first point that I'm going to tell you. First thing, you have to practice MCQs every day. Every day you have to practice at least 100 to 200 MCQs, which will include previous year questions from NEET PG, or if you're preparing for INICT, then previous year questions from INICT, which is available on all the platforms like Marrow or PrepLadder or Unacademy or XYZ, any platform that you're using, as previous year questions are available on all platforms. And not just previous year, you have to practice other questions also, because we know NEET PG is an MCQ based exam. It's not a theory exam. Reading for your theory exam is a completely different thing, and preparing for a MCQ based examination which has 4 choices and which has negative marking has a completely different strategy that you have to follow. And for that, you have to have that confidence of solving MCQ every day. Once you start solving MCQs every day, you learn the art of cracking an MCQ based exam. The thing is that once you start solving questions on a regular basis, you'll be able to understand and recognize the pattern behind the question, and you will be able to rule out the options and come to the correct option, even if you don't know right away what's the right answer. But once you know how to rule out the options, you'll be able to get to the correct answer very easily. And even if you don't know the answer, but you have been practicing so many questions every day, subconsciously your guessing power will get so good that subconsciously your mind will go towards the right answer, even if you don't know the reasoning behind it. Because 19 subjects is a lot, and not everybody, I don't think anyone, even the topper of NEET PG examination, can complete all 19 subjects and retain those 19 subjects, retain all that information in mind during the examination. So you have to have the strategy of ruling out and making your guessing power strong, so you're able to guess correctly. Now, I know it's not easy to actually do 100 questions every day from the very beginning of your preparation. So earlier you can start by doing 20 to 50 questions every day, whichever you feel comfortable with. And eventually, as you move forward, you can increase that 50 questions to 100 questions. And as you get nearer to your exam, like 1 month left, then you have to increase that 100 questions to 150 questions and 150 to 200 questions. And those 200 questions that you will be doing every day shouldn't be of the same subject. They have to include multiple subjects, so your mind is able to crack those questions, and it knows that you're jumping from one question to another question, and that one question was from another subject and the second question was from another subject. So let's move on to the second point. You have to plan at least 3 revisions before your main examination. Now, how do you plan those 3 revisions? The first revision's duration should be around 45 days. The second revision should be around 20 to 25 days. And the last revision should be between 8 to 10 days just before the examination. Those last 8 to 10 days before the examination is the most crucial period, I think, because you have to consolidate, you have to revise 19 subjects in those 10 days. And it's an extremely tough job, I understand that, but you have to do it. If you don't revise everything, or at least the most important things of all the subject in the last 10 days, then you're out of the competition. Now, you will be thinking that how do you plan this last 8 to 10 days revision? The answer lies in the next point. So let's move on to the third point. third point is making a 20th notebook or having an alternative of the 20th notebook. What is a 20th notebook? I assume that most of you know what is a 20th notebook. It's a notebook which consolidates or which has all the information about all the subjects. Everything important from all the subjects is being consolidated, is being formed in a concise manner into one notebook, which will be of around 200 or 300 pages depending upon you, because everybody's 20th notebook is personalized. If I say that I'll give you my 20th notebook to you and you can read it and you will crack the exam, you'll get a good rank, then it's a myth. It will not happen. Everybody has to make their own 20th notebook. Or if you are not ready to make a 20th notebook, you are not ready to put in that effort, because it takes a lot of effort to make that 20th notebook. From the very beginning of your preparation, from early on, you have to have a separate notebook so that you know that this information was important, I have to put it in my 20th. So if you're not ready to make it and you want someone else's 20th notebook, I think it's better to have first aid with you or BTR of Zainab Vora ma'ams. Everybody will be following Zainab Vora ma'am. I know I myself am a very big fan of hers. I have been following her. I did watch her videos and it helped me crack the exam in a much better way. It helped me understand the subjects in a lot better way. So if you're not ready to make your own 20th notebook, I will suggest you buy First Aid. First Aid is my first recommendation because it's an amazing book. It is like an NCERT for NEET PG examination. From 19 subjects, around 10 to 11 subjects you will get covered in First Aid, which includes pathology, microbiology, psychiatry. All these subjects are given beautifully in First Aid, which is our First Aid USMLE Step 1. I'm not talking about Step 2 examination, but Step 1. So you can follow that. It will be a part of your 20th notebook. But the First Aid doesn't have gynecology, it doesn't have pediatrics or forensic medicine. So some of these subjects you'll have to focus somewhere else. First Aid will not be able to provide you information regarding these subjects. So for these subjects, you'll have to make another 20th notebook. But for other subjects like microbiome or psychiatry or pharmacology, pathology, biochemistry, medicine even in fact, and some part of physiology and anatomy also, these subjects can be completely covered by First Aid. Because to be very honest, you cannot expect yourself or you cannot expect even the topper to be able to complete all the notes, all the main notes of Marrow or Preplatform or any other platform, to be able to cover every information in the last 8 to 10 days. You have to concise, you have to filter down the most important things that you have to read before the exam. So for that, you have to have something which is less, not very vast, something which has everything important, every important topic of every subject, not just 1 or 2 subjects. What people do, I have seen that people revise 2 to 3 subjects just before the exam and they think that I will remember everything else and I'll, vomit it out in my exam. But it doesn't happen. It doesn't happen. If you are able to revise at least 15 to 16 subjects before the exam in 8 to 10 days, only then you are in the competition. If you're not able to revise at least 15 to 16 subjects, then you will not remember anything. Even if you have repeatedly studied it for 3 times or 4 times or 5 times, it doesn't matter. Last 8 to 10 days revision is extremely, extremely crucial, and for that you will have to have a 20th notebook or First Aid or BTR notebook of Zainab Vora ma'am. So these were the 3 tips that I think everyone should follow. These things are non-negotiable. It doesn't matter from where you study, from which platform you use, which book you use, which professor you want to follow. Please let me know if you want me to make another video regarding any other preparation tips.